Hello, everyone, and welcome back. Dr. Catherine Y. Brown here, your host. Today on my pulmonary hypertension awareness journey to reach 100 voices, I'm excited to introduce you to Felicia Haines. Welcome, Felicia.
Thank you for having me. I appreciate it.
Oh my goodness, I appreciate you even more. So as we get started, and this is going to be viewed by everyone because we're going to launch the podcast nationally and internationally. Can you just tell us about your background and what is a day in the life of Felicia Haines like?
Well, my PH background, I initially started bedside working with our PH population, a lot of WHO Group 1 PHers, so our PAHers who are usually our IV Remodulin patients. So a lot of bedside experience there working with our specialists. I currently am still working in PH. I do clinical trial research. So our agency works with large sponsors and pharmaceutical companies and like that, and we bring drugs that could potentially help our PH patient population and hopefully one day find a cure.
I love it. So tell me, like your educational background, because we know you're a nurse, but tell us a little about that journey. But also, where did your passion for pulmonary hypertension come in? How did you get into this work?
So I have not always been a nurse. I used to be a classical orchestral musician and a music teacher as well. And then once I decided to start a family with my husband, we both kind of had a 180 into the medical field. So now I became a nurse, and I didn't even really know what pulmonary hypertension was. I came in as a fresh new grad nurse, and luck of the draw, ended up on a unit that also cared for pulmonary hypertension patients. And that ended up becoming one of the most interesting disease processes I had come across as a nurse. And honestly, the physicians and the patients in that disease process really made it for me, helped me understand the disease process. And because the disease process is so complex and the treatment options are so narrow, you really get to know your patients, you build rapport with your patients, you become super attached, and you usually see these patients very often. They're hospitalized a lot. So become very attached and create a personal connection with them.
Absolutely. So I love that you said that, because as a caregiver for my mother, that really is true. You do start to form a family with those providers because they know you well, and then they begin to listen to you and value your opinion because you're watching everything that happens. My mother, she was on Flowland, so
Okay.
then she switched to some other things. So tell me this, for those who are watching, how would you explain pulmonary hypertension to a layperson that is watching this now?
So like I said before, pH is so complex and there's so many different facets. And then you hear who group this, what, how, all these different acronyms and stuff like that. But basically what happens is all of these little blood vessels in your lungs get super compressed and constricted. And so therefore the oxygen cannot go in and out the way it needs to. So a lot of these patients have the hardest time breathing. There's so many different pathological ways that people develop PH, but the biggest thing is that these people basically can't breathe. So we come in hopefully with a medical modality that can help them have a better quality of life.
I love it. What are some of the most common medications that you see your patients on there? And also, what's the age range that you see?
So I do deal a lot with our WHO Group 1 PH patients. And so that's our pulmonary arterial hypertension patients. A lot of these patients usually start out on oral medication. So we see a lot of Opsumit, Orenitram, Adempas, even some inhaled stuff like Tyvaso. And then some of our extreme patients who are on double and triple therapy end up on Remodulin or Flowland, Velitri, stuff like that. And our age range, I mean, I've seen as young as 18, 19 years old that I've cared for personally. And then, all the way up into our elderly population, 70s and 80s on IV medication.
Yeah, so I'm familiar with, particularly my mom, the Flowland, and then we transitioned to the Velitri.
Mhm.
Yeah. So, and that's a journey in itself, right? I mean, just maintaining it. So, what advice would you give to providers? I know from a common experience when you go to the emergency room, for example, right? And she needed ice packs, and you say, "Hey, can we use your freezer?" And they say, "Oh, this is only for the staff." So, what advice would you give maybe for people who are providers that are not familiar with pulmonary hypertension, because it is rare, and so you people like you are my heroes because you take the time to really to learn and to help people. So, hero nurse Felicia Haines, what advice would you give?
So you're absolutely right. Like we kind of mentioned before, it's severely underdiagnosed, very hard to diagnose. We need a specialist really to kind of dig in and see what's going on. And because a lot of providers are so unfamiliar with the disease process and kind of what all it entails, uh, I feel like for providers out there, these patients have learned to be their own advocates, and all the education they receive inpatient, especially when they are receiving education on medication compliance, they learn to be their best advocate. They say, "This is what I need. I will not settle for anything less," because they understand that these medications are their lifeline. So I say for providers out there, if your patient is insistent that they need this item, an ice pack, something so simple for their life sustaining medication, who is it going to hurt if you give them an ice pack? Nobody. And what you're doing is actually helping them preserve their medication that they use as their lifeline. So my biggest thing is listen to your patient, and even their partners, whoever happens to be with them, their support system, because they are going to be educated as well in their disease process to an extent, but they are their biggest advocate, and they have been trained and learned to be their own advocate, really.
Absolutely. And my mother, she was a nurse for over 40 years, but I love nurses because they also help to train my daughter. And this is I don't know if you've ever seen this happen, but we had an issue where the ambulance had to be called, right? And so they got to the house and they did not know anything about how to use the pump.
Mm-hmm.
And I wasn't there, and they had to go get my daughter from high school. They sent a vehicle to go get her from high school to come back to the house to help them to know how to use the pump. And that is really frightening that providers in our EMS, they don't always know anything about these pumps. Have you, is that an anomaly, or have you seen that or heard of that happening as well?
That's unfortunately super, super common. And what I have found, at least locally, with a lot of our specialty pharmacies, what they will do is they will reach out to those emergency medical service providers, like the fire station or like those ambulance companies and stuff like that, and say, "Hey, there is somebody in your jurisdiction who has this disease process. They have a medication pump. It is not an insulin pump. Do not turn it off." Because they think, well, their blood pressure is super low. We should definitely turn this off. Not knowing what the medication is or what happens when you turn the medication off. So at least local to us anyways, some of our specialty nurses will go and reach out to those people out in the field and say, "This person in your jurisdiction has this disease process. They utilize a pump. Please do not mess with it. Please listen to your patient or their caregiver about the pump." So they try to be more proactive, or they will tape like little cards to their IV lines or onto their pump that says, "Do not stop life-sustaining medication." So they try to be as proactive as possible within their circumstance if they can. But unfortunately, it is very, very common.
I mean, and I suppose when you're going through it, you feel like you're the only person in the world that's going through it, but it is it's a nightmare when it happens. Another situation that we had happen, and I'm curious to know if this is something that you have seen and how you deal with it, is that when they get admitted to certain units, depending on if it's an agency nurse or something of that nature, they also don't know anything about the medication. And a lot of places will say it's up to the family members to maintain the pump while the person is hospitalized. So that means the family member has to come from the house to manage the pump, and the pharmacy will mix the medication and send it up. But I've had a situation with that, but also where has the right person, right dose, and we checked it and it wasn't my mother's name on it. And so luckily we knew how to check at all times. But other than that, she would have got another person's medication. So have you seen it where, depending on the unit that they're on, the staff doesn't even know how to manage a pump, and the families have to maintain the pump while the person's hospitalized?
I have, of course, heard horror stories, unfortunately, being in the nursing profession. However, I have been incredibly fortunate at the agency that I work at. We have a very dedicated pulmonary hypertension group, and we're a pulmonary hypertension accredited institution. So those providers actually provide a 6-week class to their nurses, residents, and pharmacy, anybody who could potentially come in contact with these PH patients. They provide a 6-week class with like a test at the end, and you have to pass this test in order to be able to care for these patients. And then we actually have a PH dedicated unit for these patients as well. So there's always, if these patients are on these medications, we know that they have an established history of PH or are being evaluated for PH. They are assigned to this unit, and then they are also being cared for by what we call pulmonary hypertension certified nurses through our institution. So they take exceptional care, and it's one of the most important aspects of how they train us here, at least for our center.
Listen, bravo and kudos. Now, I didn't ask you, what city and state are you in?
Yes, so I'm in sunny Florida. It's like 5 million degrees, and I'm in Orlando, so near Disney World.
Yay! Happiest place on earth. As we transition and we think about people when they come towards the end of life and what that looks like for them, we know we always want people to be comfortable and have dignity. And again, and I share my story because I want other people that watch this to know you're not alone. But then there are places like where you're describing where you don't have to deal with it. But right before my mother got discharged, that heart is not functioning right like it should. And so they have to do the epi. But for her to get hospice care, they said that we had to DC the pump. Well, Nurse Haines, if you DC the pump, it's a life-sustaining medication.
Exactly, yes.
Again, is that an anomaly that we experienced? Have you heard that? And if that is the case, how do you prepare people for dignity in their final days?
So that is common in the medical world. When people transition to hospice care, they no longer provide life-sustaining services or medications. And so we really make it a point to sit down with their patients and determine goals of care, quality of life, if they want to pursue palliative care versus hospice care. And then, unfortunately, once the decision is made to go to hospice, they do titrate down the medication and eventually turn off the pump and provide comfort care. It's a very hard conversation to have, and I can't even begin to imagine to have that with a patient. Our providers are incredibly skilled in presenting that information, laying out all the options, answering questions, and allowing these patients to make the best decision for their circumstance. So it's super difficult to watch, and again, we try to make sure that these patients know they're not alone. There will always be somebody there. Here are your options. And we want them to be as educated as possible when making the decisions about end of life care.
I love it. And so, for those of you watching, I try to be as transparent, right, in the conversation, but having conversations really does matter. Getting care from certified centers, skilled people who are trained. In my instance, we chose not to go that route because we were medical professionals. My son's a nurse, and so we brought mom home. So she transitioned very comfortably at home. And just a few hours before she passed, she said, make sure you get because we do the Roberta Banks Wheeler Pulmonary Hypertension Awareness Day, make sure you get the t-shirts and continue the work. And
Oh.
so for her to say that just a few hours, that's a nurse for you, right, Nurse Haynes? Only a nurse would do that.
Absolutely, absolutely.
Do that to you. So our mantra is awareness, empowerment, and hope. Together we can make a difference. What are the first things that come to your mind and words of wisdom that you would share on those words? Awareness, empowerment, and hope.
So honestly, it's education, education, education for me. I used to be a teacher, so that's still super near and dear to me. The more you know, the more educated decision you can make, whatever would be best for you. And even as a provider, being as educated as possible in this disease process and providing as much information for my patients. So education, literally the sky's the limit. So the more you know, the more you can do, and the more that you can provide. So the more you know, the more you're empowered. And then the more you're empowered, the more hopeful you are because you have that longevity there with your education. And so I definitely believe that for us in our PH world as a nurse anyways.
I love it. Is there any, as I go forward in the community, where our goal is to increase awareness of pulmonary hypertension while building healthier communities, and our target audience is patients, caregivers, medical professionals, and the community. So you've given me some good ideas today about workshops and seminars for people. Is there any other things that you've seen done that work well that a small nonprofit, not so small, we're going to grow, but that you would suggest that we should be doing? We've done, we do health fairs, we're doing this podcast series, again, educating providers. Is there anything else that you would suggest?
One thing that I found that has been super helpful, especially for newly diagnosed PHers in the community, is support groups. And so that's been a really amazing way for people to connect and, again, not feel so alone. Somebody else is also struggling with this. People develop relationships kind of like a mentor-mentee mentality. Just, this is new to me. What should I expect? Is this normal? Not feeling so alienated, because it is a very complex disease process. It is definitely changes your quality of life and the way you do things, especially later on in the disease process. So support groups have been incredibly helpful, especially for newly diagnosed patients.
And do you see anything done with children? Like, I remember with my son, I have 4 children, but the baby, they did handprints of my mother's hands and her feet in the hospital. And we still have that. Have you seen any things that you all do that's super innovative? What's the most innovative thing that you do when you're working with families and patients?
So one of the things that we do here at our center, usually similar to like end of life, we have a service called like Child Life Services, and they will actually do molds of people's hands. So you can actually do a mold of like you and your loved one's hands and have that kind of like as a keepsake.
I love it. I love it. And I love to hear those ideas because it matters, and families actually keep those keepsakes. So it's a beautiful, beautiful thing. Nurse Felicia, I thank you so much from the bottom of my heart for the work that you do. You are a hero because there are so many people that don't have someone like you to advocate for them. So I just want you to know, if you did not hear it today, you are amazing. You matter. Your life matters. And we just thank you for doing this work. This community is often overlooked, and we don't always get a Nurse Felicia Haines. So you are a rock star hero.
Thank you so much.
Is there anything else that you want to share that I have not asked you? And then after that, I do have one more question.
I would say for the PH community, continue being your biggest advocate, because you know more than you think you know.
Oh, I love it. You know more than you think you know. For providers like you, is there anything that we should do? We do a caregiver appreciation day, but what should we do, or even to think about, to have to empower and keep you all uplifted? Because this is work of the heart, and it's not easy to deal with people who are going through that. And I've seen it in some of my mom's nurses. They get tired too. So how do you stay motivated and inspired, engaged, and what should we be doing to help uplift amazing caregivers like you?
So staying inspired really is just maintaining myself in the PH community, because I'm incredibly passionate about pulmonary hypertension. But as a community, I think that, making sure that you're getting out and voting and stuff like that, especially for things like safe ratios, proper staffing in hospitals and things like that. So that way, not only are we not tired and burnt out, but also our patients are as safe as possible and getting the type of care that they deserve and need to have.
Oh, you know what? That's a powerful point. Safe patient ratios and making sure that the team is allowed to get proper rest. And I'm repeating that because I want people to hear exactly what you just said, right? Because there's accountability if a mistake happens, but there has to be accountability on the front end to make sure that you all are taken care of, just like you take care of all of us. So thank you again for being here. I appreciate you. And for our viewers, you have just met my hero of the day, Nurse Felicia Haines, and continue to share this podcast with other people and follow this message, because we are going to make it on the road to 100 voices in the pulmonary hypertension awareness community in honor of RBW PH Awareness Group. I'm Dr. Catherine Y. Brown, and until next time, have a great day. Thank you, Felicia. You are the best.
Thank you so much for having me.
Yes, so I